Have you ever looked down at your arms or legs and noticed unexplained bruises? Even though you never bumped into anything, never fell, never got hurt, and quietly told yourself, it's probably just age. I'm Dr. Mark Ellis, and what I'm about to tell you may save you from a medical emergency that thousands of Americans never see coming. Because in my clinical practice, I've seen people who believed they were protecting their heart doing something as simple and natural as eating garlic every day, only to end up with internal bleeding, dangerously thin blood, or life-threatening complications that develop silently right beneath the surface. Here's the frightening truth most people don't realize: when garlic is used the wrong way, at the wrong time, or by the wrong person, it doesn't just lose its benefits. It can actively amplify the effects of blood-thinning medications, interfere with surgery recovery, and place severe stress on already vulnerable kidneys. And the warning signs are often subtle until they suddenly aren't. But stay with me, because this is not about fear, it's about clarity. In the next few minutes, I'm going to show you exactly who should never use garlic casually, why these risks increase after age 40, and most importantly, how to use garlic safely or avoid it completely before it turns from a health habit into a medical emergency. And if you think this doesn't apply to you, that belief alone may be the most dangerous part. For most people, garlic feels harmless. It sits in your kitchen, goes into your food, and has been praised for decades as heart-healthy and natural. That's exactly why this danger is so easy to miss. Because the problem doesn't start with garlic alone. It starts when garlic enters a body that's already being chemically altered by blood-thinning medications. In my practice, I've met countless patients who told me the same thing: I thought I was doing something good for my heart. One man in his late 60s comes to mind immediately. He was taking a low-dose aspirin every day after a minor cardiac event. Nothing unusual. His doctor approved it. But what his doctor didn't know, and what no one had warned him about, was his morning routine. Every single day on an empty stomach, he swallowed 2 raw cloves of garlic because a friend told him it would keep his blood clean. At first, nothing happened. And that's the most dangerous phase, when the body's already drifting into unsafe territory but gives you no obvious alarm. By the second month, he noticed bruises forming on his arms and legs. Not painful, not dramatic, just strange. Then came the nosebleeds. Then the bleeding gums. He ignored all of it because none of it felt urgent. Until one evening, a small cut on his finger wouldn't stop bleeding for over 30 minutes. Here's what was happening beneath the surface. Garlic contains allicin, a biologically active compound that naturally inhibits platelet aggregation. In simple terms, it slows down your blood's ability to clot. Aspirin and warfarin do the exact same thing, but through pharmaceutical pathways. When these mechanisms overlap, they don't cancel each other out. They amplify each other. Clinical data shows that combining garlic with anticoagulants can increase bleeding risk by 50 to 100%, depending on dosage and individual metabolism. That means your blood doesn't just become a little thinner. It can cross the line into dangerously thin without you ever realizing it. And the warning signs are almost always subtle at first. Unexplained bruising, frequent nosebleeds, bleeding gums when brushing your teeth. Many people chalk these up to aging or sensitive skin. But medically, these are early red flags that your coagulation system is being pushed beyond its safe limit. This is where I want to speak directly to you for a moment. If you are over 40, if you are taking aspirin, warfarin, clopidogrel, or any blood-thinning medication, even at a low dose, and you regularly consume raw garlic juice, or concentrated garlic supplements, you are operating in a risk zone that most people are never warned about. And yes, this includes products labeled natural, herbal, or heart-supporting. Now, to be clear, this is not about fear, it's about precision. Garlic used as a small culinary ingredient is very different from garlic used daily as a medicinal substance. The body doesn't interpret intention. It only responds to biochemical load. And when that load stacks up day after day, the consequences don't announce themselves loudly. They whisper first. So what's the safe approach? If you are on blood-thinning medication, raw garlic should never be treated like a supplement. Avoid garlic juice, raw cloves, and concentrated extracts unless you have explicitly discussed it with your physician. Cooked garlic in small amounts is generally safer because heat significantly reduces allicin activity. And most importantly, any new bleeding symptom, no matter how small, should never be ignored or explained away as just age. Because once bleeding becomes internal, the timeline changes dramatically. Gastrointestinal bleeding and cerebral hemorrhage don't give you second chances. And here's the part that most people don't expect. Even if you stop garlic today, even if you recognize this risk in time, blood is not the only system garlic affects. There is another situation far more common, far more underestimated, where garlic quietly increases danger, even in people who aren't taking blood thinners at all. And just knowing this first risk isn't enough, because the next one becomes far more dangerous when surgery enters the picture. Now, if garlic can quietly thin your blood during everyday life, the danger multiplies when your body faces something far more serious: surgery. And this is where many people make a mistake that doctors don't always catch in time. I remember a woman in her early 70s who was scheduled for what she was told was a minor procedure, a routine eye surgery. No major risks, no long recovery. She followed every instruction carefully. She fasted. She took her prescribed medications exactly as directed. But no one asked her one simple question: have you been consuming garlic regularly? For years, she had been drinking a small glass of garlic-infused water every morning. It was her habit, her ritual, something she never even thought to mention, because to her, garlic wasn't medicine, it was food. During surgery, her bleeding was far heavier than expected. The procedure took longer. Recovery was slower. And afterward, her wound took weeks longer to heal than it should have. Only later did the connection become clear. Here's what happened. Garlic doesn't just thin blood in theory. It actively suppresses platelet function, the very cells responsible for forming clots and sealing wounds. Platelets are like emergency repair workers. When tissue is damaged, they rush in, bind together, and stop bleeding. Garlic interferes with that process, and unlike many drugs, its effect can linger. That's why surgical guidelines consistently recommend stopping garlic at least 14 days before any procedure. Not just major surgeries, but dental work, cataract surgery, joint injections, even biopsies. Because once platelet function is impaired, your body loses its ability to protect itself at the exact moment it needs that protection most. Studies have shown that patients consuming garlic supplements or raw garlic before surgery experience higher rates of excessive bleeding and delayed wound healing. In some cases, surgeons are forced to halt procedures, increase cauterization, or manage post-operative bleeding that could have been avoided entirely. And this is where the danger becomes especially deceptive. Many people believe that once surgery is over, they can immediately return to their healthy habits. They add garlic back into their meals, or worse, resume garlic juice to heal faster. But in older adults, healing already occurs more slowly. When garlic is reintroduced too early, it can prolong bleeding, increase infection risk, and interfere with tissue repair. The solution here is not complicated, but it is critical. If you are scheduled for any procedure, stop raw garlic juice and garlic supplements at least 2 weeks beforehand. After surgery, wait until the wound has fully healed before reintroducing garlic, and even then only in small cooked amounts. And most importantly, always tell your surgeon or dentist about any herbal habits you consider normal. What feels normal to you may be biologically significant to your body, because when bleeding becomes uncontrollable in an operating room, there is no room for guesswork. But here's the part that almost no one talks about. Even if you are not on blood thinners, even if you are not facing surgery, garlic can still trigger a far more silent and dangerous chain reaction, one that begins deep inside the kidneys and ends in the heart. And just knowing this second risk still isn't enough, because the final factor may determine whether kidney damage stabilizes or progresses to dialysis. So far, we've talked about blood, how garlic can quietly thin it, and how that risk explodes during surgery. But there is another organ involved in this story, one that rarely causes pain, rarely screams for attention, and yet quietly decides how much stress your body can survive. That organ is the kidney. I want you to imagine your kidneys as highly sensitive filtration systems. In a healthy body, they work non-stop, clearing excess minerals and waste from your blood, maintaining a delicate internal balance that keeps your heart beating steadily. But when kidney function begins to decline even slightly, that balance becomes fragile. I once cared for a patient in his early 60s who believed he was doing everything right. He wasn't on blood thinners. He wasn't preparing for surgery. But his lab work showed early kidney impairment, something he barely paid attention to because he felt fine. Every morning he drank concentrated garlic juice, believing it would detox his body and protect his organs. Within weeks, he began experiencing strange symptoms, weakness, irregular heartbeats, shortness of breath at night. He thought it was stress. It wasn't. His blood tests revealed dangerously elevated potassium levels, a condition known as hyperkalemia, and it was putting direct electrical stress on his heart. Here's the science behind what happened. Garlic, especially in concentrated forms like raw cloves, juices, and extracts, contains a meaningful amount of potassium and bioactive compounds. In a healthy individual, the kidneys filter excess potassium efficiently. But when kidney function declines even moderately, potassium begins to accumulate in the bloodstream. Clinical studies show that reduced kidney clearance dramatically increases the risk of potassium overload. And elevated potassium doesn't cause pain. It interferes with the heart's electrical conduction system. When potassium levels rise too high, the heart can slip into dangerous arrhythmias or stop entirely without warning. This is why patients with chronic kidney disease or even early-stage kidney impairment are strongly advised to avoid concentrated garlic products. Garlic juice is not a gentle cleanser for them, it is a metabolic shock. The kidneys simply cannot process that load fast enough. And this is where the misunderstanding becomes deadly. Many people assume that because something is natural, it must be safe. But the kidneys don't care whether potassium comes from a supplement or a vegetable. They respond only to quantity, speed, and their own remaining capacity. Once that capacity is exceeded, the consequences escalate rapidly. So what is the safe path forward? If you have been told your creatinine is rising, your eGFR is falling, or you are on dialysis, raw garlic and garlic extracts should be avoided entirely. Cooked garlic in very small amounts used purely as a seasoning may be acceptable, but only with medical guidance. Garlic should never be treated as a daily therapeutic drink when kidney function is compromised. Because when kidney filtration fails, the heart is often the first organ to pay the price. And this brings us to a critical realization. Garlic is not dangerous by itself. What makes it dangerous is who is using it, how it's being used, and what condition the body's already in. Before we end, I want to speak to you not as a warning voice, but as someone who truly cares about your long-term health. If you've watched this far, it tells me one important thing. You don't take your body for granted, and that already puts you ahead of most people. Kidney health, heart health, blood balance. These are not things that suddenly disappear overnight. They change quietly over years, shaped by small daily habits that often feel harmless. The goal is not to fear foods like garlic or to eliminate everything you enjoy. The goal is awareness, to understand when something helps your body and when it silently adds stress. Especially as we get older, wisdom matters more than intensity. Doing things naturally is not the same as doing them safely. If you are taking medications, preparing for medical procedures, or have ever been told your kidney function isn't what it used to be, I encourage you to pause, reflect, and talk openly with your healthcare provider about your daily habits, even the ones that seem too small to mention. Those details matter more than you think. I also encourage you to save this video, not out of fear, but because information like this is easy to forget and incredibly important to revisit. And if you care about protecting your kidneys, your heart, and your independence as you age, make sure to subscribe to the channel. I share clear, medically grounded guidance here, not trends, not hype, so you can make informed decisions before problems become irreversible. Most importantly, remember this: your body's not fragile, but it is honest. It responds directly to how it's treated. With the right knowledge, thoughtful choices, and steady habits, you can protect your kidney health, reduce unnecessary risks, and continue living with strength and clarity for years to come. Take care of yourself, take care of your kidneys, and I'll see you in the next video.